Well, hello, everybody. I'm Washington County Executive Josh Schoemann, and I'm here today with our Public Health Officer, Kirsten from the Washington Ozaukee Public Health Department. We wanted to take an opportunity to talk to you today a little bit about what's going on with vaccinations and some of the latest updates with COVID-19. I know it's been quite a while since we talked last and had a video of this variety, so we thought with all the uncertainty about what's happening recently, all kinds of news from every direction, we thought we'd give you a look into what's happening here on the ground in Washington and Ozaukee County. So, Kirsten, could you start by telling us a little bit about what's happening at the state and federal level? You know, from our vantage point, it looks like a mess. Is it, or what would you say to people?
I would say it is a little bit of a mess. I think the biggest challenge right now is the demand is much greater than the supply, and the supply is unclear how much supply there is. And I think that comes from the federal level. The state doesn't know how many doses they're going to get per week, and then as a result, the health departments and healthcare systems who are administering the doses can't plan to do clinics because we don't know how many doses we're getting.
So there's a committee at the state level that's helping to determine how and who and when all of these different classifications of people are getting the vaccination. How is that working? Does our health department have input on that? Does local health have an input on that? Tell us a little bit about that.
Sure. So the federal government made recommendations on who should get vaccine first. And then each state can determine based on what the federal government put out if they're going to follow those guidelines or create their own. So you've seen in Florida, for example, they're doing a different population than we are here. So the group in Wisconsin is called the SDMAC. There has been representation from public health on that group. I'm not sure that there is anymore. But they are making the determinations for our state. And then based on that guidance, DHS tells local public health departments who they can begin to vaccinate. So for example, in 1A, we started with EMS providers, so those who are the very first responders, and healthcare workers, so those who are on the very front lines. And then it was opened up to law enforcement, so fire, police, other organizations, DEA, FBI, some of our folks who work in sheriff's departments, for example. And now we have moved on to 1A, more broadly 1A, so unaffiliated healthcare workers, which is a pretty big category, but chiropractors, dentists, dental hygienists. And now, as we all know, 65 and older has been opened up. And that is really based on the guidance by SDMAC, which is the Wisconsin group, who's giving the information to DHS.
Okay, great. So in Washington County, what that has meant for our county organization, for example, is at our Samaritan Nursing Home. A lot of the staff over at Samaritan have been vaccinated, actually a couple of weeks ago already. Corrections officers in our jail, sheriff's deputies, a lot of law enforcement, as Kirsten was talking about. So it's happening right here in Washington County in real time, and so we're very excited about that. Once it gets down to the local level, it sounds like there's just a lot of moving parts and pieces, federal, state. But once we finally have it here, tell us a little bit about the process for how do we request it, how do you know when you're getting it, do you get what you're asking for, those types of things.
Sure. So the local health department, we are serving in a role a couple of ways. So the first is we are offering vaccine clinics every week, and the number of appointments are really based on the number of doses we're allocated. So we don't find out, we order at the beginning of the week, and we usually don't find out until the end of the week or potentially the weekend how many doses we'll have for the next week. So based on that, we are hosting vaccine clinics. And then we're vaccinating those who are identified by DHS as priority groups. In addition, we are coordinating, so there are private pharmacies who are getting vaccine, we have healthcare systems who have vaccine, and we're making connections between people who want vaccine, so populations, for example, or a nonprofit organization that has social workers, we may connect them directly to a pharmacy that has 40 doses. So we're also serving in sort of this matchmaking process. And then in addition, part of how we got through our fire and law enforcement so quickly in Washington and Ozaukee County is through partnerships with our healthcare partners. So they reached out to the health department and said, okay, we're ready to open up to law enforcement. So we connected them with all those emails and contact information so they could vaccinate those populations.
Interesting. So not only are you a distributor or provider, you're also, as you said, a matchmaker.
Right. Coordinating it.
Mm-hmm. So lots of complicated processes happening all at once. Sounds like it. So we hear a lot about phase 1, phase 1A, phase 1B, all of that. And what does that all mean here at the local level? So for example, it seems to change in real time. One day we're hearing that 65 and older is going to be a couple weeks from now. Next thing you know, you can start it now. It officially starts Monday. We hear that people in prisons are getting vaccinations, and then there's a big push for people working at grocery stores. How is it actually playing out on the ground here in Washington, Ozaukee County?
Sure. So again, the demand is greater than the supply. So we have a limited number of doses. The opening up to 65 and older, for example, that was pushed out earlier this week, we don't have enough doses for that entire population. So between the two counties, that's over 35,000 people. And for context, we got 700 doses last week. So we are still working through 1A. So we are following the DHS guidance, but as we have more doses, then we're continuing to open up for the other populations as they're being identified. So at the end of this week, we will have worked through all of 1A for both counties, which is, again, those unaffiliated healthcare workers, law enforcement, all of our nursing homes, the nursing home staff, I'm missing like some major groups, but everyone in 1A should have had access by the end of this week for both counties.
Oh, okay. So we're really starting now next on Monday to move into 1B. And how long do you anticipate that will take?
So dependent on how many doses we have. I think we're really hoping and leaning into our healthcare partners that they will start to vaccinate individuals who are affiliated with them. So for example, if your primary care doctor is with Aurora or Freighter, that they will offer you a vaccine. And that will really help us in terms of how many doses we can get in our arms. Our hope at the health department is that we start to fill the gap. So people who maybe don't have a primary care doctor, haven't been to the doctor in a few years, that we are able to get them through our clinics.
So it looked like from our vantage point here in Washington County, like the Trump administration had done a good job with Operation Warp Speed and getting us to the point of approval. And then there was this kind of pause in time where we're trying to figure out how do we actually get that vaccine into the people's arms. And now the Biden administration has said in 100 days, they want to get everybody completed, right? So is that realistic based on what you're saying? Do you feel like, you know what, we can get this done, or are there just too many questions right now?
I think we could get it done if we work collaboratively. So it's critical that the healthcare systems take a significant number of people to vaccinate, that the health departments are vaccinating at a high level, that our pharmacies, our private pharmacies and large pharmacies are also vaccinating. If everyone is working together, it's possible we could get through everyone in 100 days. I think the other piece again is that supply. So if there's a way to generate more doses and to have it actually manufactured more quickly, then I think we can get there. But I think that's a critical piece. Is the supply chain is just not there.
And we've heard, I think, a couple of different companies right now, Moderna and Pfizer, have vaccinations out there. My understanding is there's others as well in the pipeline. Have we any idea when those are coming?
So there are two that are next. So AstraZeneca and Johnson & Johnson. Johnson & Johnson's only one dose, which is fantastic. It'll make it much easier to administer that. And they should be approved in February. So once they're approved, I think that once those two come onto the market, we'll be able to get through much more quickly.
Yeah. So with that, a number of the current vaccines that are out require 2 doses. And you mentioned that people have to register based on qualifications and so on and so forth. Once they register, how do we know that they're able to get that second dose and that they're going to get it?
So the second dose has been promised. I think there was some misunderstanding that the second doses were sitting in a warehouse somewhere, but in fact, the second doses are intended, they're being manufactured and shipped as they're manufactured. So as a health department, we've been promised that we don't even need to order the second dose. It will automatically come to us for the individuals who've had the first dose through us.
And the system, the process for if I'm a 1A person, a law enforcement officer, I've gotten my first shot, how do I know when I'm going to get the second shot? How is that scheduled?
So it's really dependent on where you go to get your shot. But my understanding, and this stands for healthcare and for the health department, that when you make your first appointment, you make your second appointment at the same time. And it's exactly 4 weeks later.
So it's kind of like going to the dentist. You get your teeth
before you leave, you make your appointment for 6 months later.
Okay.
Yeah, but in this case, it's 4 weeks for Moderna.
So what do you, from your perspective, you're in the day-to-day, literally in the weeds, on the ground, seeing what's happening. For the layperson who doesn't see that, what should they really be thinking and looking at right now?
I think it's critically important that people keep every avenue to vaccine open for themselves. So let's say you get an email from your doctor's office that says, make an appointment, but it's not for 6 weeks. But then maybe you have an option, there's a pharmacy near your house that puts out a flyer, or you get you see something on Facebook or social media that says, oh, you can get an appointment here. Take any avenue open. Don't wait 6 weeks if there's a potential for another dose someplace else. And then the other piece is wherever you get your first dose, you have to get your second dose. So you should try to mix it up, but wherever you can secure that first dose, you should take it.
Very good. So one of the questions that I've gotten from a few constituents is, who is this vaccine all eligible for? So I've had questions about, can my kids take it? Can the elderly and frail take it? So the current 2 vaccines out, who can really take them at this point?
So Pfizer is anyone who's 16 and older, and Moderna is anyone 18 and older. So it's anyone within those categories. If you have underlying health conditions, significant underlying health conditions, or if you've had an anaphylactic reaction to medication or anything, you should talk to your physician first. But it's anyone is eligible for it.
Okay. So what about folks who are under 16? Is particularly, I'm thinking kids who have some underlying condition, some disease that they really feel like they need to get it now.
So it's not available.
Okay.
There have not been clinical trials to show whether it's safe for children under the age of 16 and what the dosing is. So I think that's the other piece. Adults are of average size, height, weight. It's not known for children, and obviously they're much smaller than adults. So we really need to wait for the clinical trials to make sure it's safe and what the dosing would be.
So do you have any speculation or any insight as to a timeline for when those folks might be?
So I think the hope is that they'll be available before school starts next year, but that might be optimistic.
Okay. So if everything goes as planned, the 100 days, you said you think if everybody starts collaborating, it's achievable. We're really talking about late April, early May. It's Memorial Day, and anybody who wants the vaccine can get the vaccine.
I'm very hopeful that by June, everyone who wants the vaccine can get it, and I think that's achievable.
So where are some of the resources, if I'm the average citizen in Washington County, what websites do I look at? Who do I talk to? Where do I go?
So if you go to the health department website, washoswi.gov, we have a link. If you're 65 and older, you can click on the link and your name. We ask for some information, demographic information, telephone number, email, so we can get in contact with you. You just fill that out, and then once we have doses, we'll be opening up a registration system. So you'll get an email to click on a link, and then you can register through us. Similarly, you should look, if you have local pharmacies, you should see what they have available, and then also your primary care doctor.
Okay. So really you're saying contact the health department, your local pharmacy, maybe pharmacies,
Mm-hmm.
CVS, Walgreens, maybe Walmart,
Mm-hmm.
and then also your primary care physicians. Okay, great. That sounds easy enough. So as this plays out, we're hoping the month of June, everybody who wants the vaccine can get the vaccine. When we're finally to that stage, do you feel like, what are you hearing? What is the science telling us with regard to social distancing and masking and all the things, the washing your hands, all the things the CDC has been telling us for over a year, almost a year now?
So the research that was done on the vaccines that are currently available, so Moderna and Pfizer, really looked strictly at whether it caused symptoms. If the individual was exposed to the virus, did they become symptomatic? And as it turns out, no. So 95% effective at stopping people from having symptoms or becoming critically ill. So we know that it prevents illness and death. What we don't know, and what they're currently researching, is if you have viral load, let's say you're exposed, you've been vaccinated, you're exposed, you don't have any symptoms, but can you, if it's in your body, can you give it to somebody else? Are you still contagious? So they're doing research to see if you are still contagious after you've been vaccinated. So it's unknown. So for the foreseeable future, we will continue to have to mask and social distance, even if vaccinated. But I think we all are looking forward to the day where we don't have to do that.
Yeah, you're not kidding. So it's so much of the what's happened since March of last year. It's a novel virus,
right,
which means we just don't know, and we're trying to give the best advice as possible. And
right.
people have to make the decisions to protect themselves and their family and their neighbors.
Absolutely.
Okay.
Absolutely.
Great, thank you. So now the elephant in the room. You're moving on to bigger and better things professionally, going to the city of Milwaukee, assuming the Common Council gives the blessing to the mayor's selection of you. How do people in Washington County, how can they trust, ensure that there's a smooth transition to the next administration for the health department and a successful closeout of the vaccines and all of COVID-19 like we just talked about?
Absolutely. So first I want to say it's been an honor to serve the residents of Washington Ozark County, and I've learned so much and had a tremendous career here, so I'm so thankful for that experience. We have a phenomenal health department, and we have not been successful just because of me, and it's really because of my staff. So I have 2 staff who are incredibly competent, who are stepping in. I have 1 individual who's stepping into the interim role, another staff person who's in a leadership role who's also going to support that work, and we are posting the position hopefully within the next few days to get somebody in there as quickly as possible to stabilize the department. That said, our vaccine planning process is really in place. We've secured the locations for both counties for the foreseeable future. I think we're just positioned really well. Our contact tracing team is excellent and up and running with we have very few issues there. I think we've done a lot of planning internally to make sure that as we move forward through this pandemic and try to finish it out potentially this year, that we're in a good place. We've established really strong relationships with many community partners or school districts. I want to call it. They've been phenomenal to work with. But I feel very comfortable that the health department's in a good place and can move forward.
That's great. Yeah, those plans have really been kind of the centerpiece of what's been worked on. Whether it was the blueprint from the very, very beginning, the early weeks and months of COVID, to now, like you're talking about, the clinics, vaccination clinics, using really resources that have been built not just in the last couple of months, but really years, right?
Yes. So we've had mass vaccination plans in place for decades, really. And obviously they've had to be tweaked based on reality. So when we wrote those plans, we never anticipated that we would also be doing contact tracing and working closely with schools and case management and data reporting, which are all really critical components of a robust response in a pandemic. But those plans did exist, and yes, they've been tweaked a little bit, but we've really been working off of them. And again, I feel very comfortable that the health department will move forward. Seamlessly with great leadership.
Awesome. Well, thank you so much. I can tell you, as county executive, Kirsten has done an outstanding job. We're grateful for her service over the last several years. So happy for all the things that you've done and for your next opportunity in Milwaukee. You won't be far away, so I'm sure we'll be in touch. But I can also say that, as Kirsten noted, the process for hiring the next person is already underway. We're working through that. We've got great partners in Ozaukee County that we're trying to finish the details and get those pieces in place. And I'm very hopeful that in the next couple of months, we'll have the next director in place and closing out all of the challenges that are left with COVID-19, most importantly, including the vaccinations right now. So thank you so much for the opportunity and for giving everybody in Washington County an update. And best of luck in the city of Milwaukee.
Thank you.